I'm Andrew, and I'm here to talk to you about TestCard. So at TestCard, we've embedded a urine diagnostic device into a postcard, which in conjunction with a mobile phone application allows people to diagnose common conditions in the comfort, convenience and privacy of their own home. Everyone here is very lucky. Now, the reason you're very lucky is you've probably never been isolated from healthcare geographically or economically, but these are real problems in many parts of the world, problems that we're in early talks with the Gates Foundation to address. But people in the UK are still socially isolated from healthcare. We've talked about some of that today already, but that could be because they're elderly and frail, could be because of mental health conditions, or it could just be because there's a social stigma attached to the condition they think they might have. TestCard addresses all of these issues. Our first products on the market are a pregnancy test, a urine drugs of abuse screen, and a test for urinary tract infection. Now, we started with these tests because this is the clinical scanning technology we needed to develop within our application. Clinical scanning technology that we've recently proved in a pilot program with Roche Diagnostics to be more reliable than the in-hospital professional use products. But we're a platform technology. So that means that we can work with any rapid diagnostic or combination of rapid diagnostics. And what that does is provides a home user with true answers to the questions they're asking rather than nonsensical numerical results and clear text guidance on what the next step will be in a non-intimidating, easily applied, cheap to deliver product. When used in conjunction with a professional user, the professional user can gain visibility to results that are generated in the home, stuff that's normally invisible to them, and able to manage their patient in an outpatient capacity rather than always bringing them in. It's not always the right thing to be removing people from the safety and security of their own home. Because we can work with any test or any rapid diagnostic, we have a very full pipeline. Our pipeline includes testing for long-term health conditions such as diabetes and kidney disease, pregnancy management products, so we can go through fertility, ovulation, pregnancy, gestational diabetes, pre-eclampsia screening. We have products for screening of sexually transmitted infections, and the global health products that we're looking to develop with the Gates Foundation around malaria and HIV. We have four main routes to the market. This can be either direct to consumer through our app or through the web, through partnerships which can be with primary health providers and long-term care facilities or with insurers and employers, and direct through retail. Now, in reality, some of our products will lend themselves to one more than another. STI product, very definite direct to consumer, whereas the UTI product works really well with primary care providers and long-term care facilities. So we're here today. We've worked very well with Wayra. They've been incredibly supportive, as have Novartis. And we're in the middle of a fundraising round at the moment, and we're always looking for new partners to help deliver our product to the market. So if you'd like to come and see me, I've got a stand over there. I can give you some cards to take away. We can have a chat about what's next. Thank you very much. Oh, I wasted 12 seconds.
You just talk us through maybe your plans for international expansion, and I'm thinking particularly about potentially the US market, where of course the dynamic's very different from the UK being driven by the NHS.
So it's the danger with the US market is because effectively we save money. And within the UK that works very well. We can just say we save money. In the US what people hear is who are you taking money off of? And that's the danger within the US. And that's where these sort of partnerships and working with people works really well, especially when you have insurers that also fund hospitals. That works really well as well. Now we've entered into the US market. We were on the Texas Medical Center Accelerator. Texas Medical Center, biggest medical complex in the world. I didn't hear of it until I went there. It's just phenomenal. And what we can do over there, though, is we can enter into the wellness market, generate data within the wellness market, and then use that data to transfer it over for FDA approval into diagnostics.
Can I just ask, I think it's absolutely fantastic.
Thank you.
Particularly the at-home solution where someone wants to test in the privacy of their own home and get a result and get comfort with their symptoms. When it comes to kind of integrating with healthcare providers like GPs or A&E, how do you guys think about integrating into their systems? You mentioned that it's useful to see kind of for GPs long-term trends.
So integration, there's a spectrum of integration. What's important is that the message carries on and that we lower those barriers for the next steps for people to take those next steps in their healthcare. So we can talk about full integration. So we're working through integration with Patients Know Best at the moment, who are a supplier agnostic data cloud. So we do a single point of access. They have multiple points out. So that will go into the EMIS and System 1 practices. But we don't need to be that granular in some cases. So the work we're looking at with Superdrug, for example, all they want to know is a positive test was generated. They don't want to know the individual results that actually come out of it. So because our QR codes are individualized, we know who they've been supplied through, so we can target anything after to that. So if someone buys it through Superdrug, if they get a positive result, it says you can now click here to go to the test and treat service with Superdrug. So it lowers all those cognitive barriers people have to engage in healthcare and keeps them moving forward to the ultimate correct destination for them.
I guess from a defensibility standpoint, is the test in any way patented, and how would you compete, for example, on pricing? Because there's many tests that are super cheap and obviously not many that are accurate, but people might not know that.
So in terms of defensibility, we have 5 patents, 1 design patent and 4 application patents at the moment. They're patent pending. A lot of them are around how the card and the phone interact with one another. The barrier to entry with this really is to do with light and how we control for ambient interfering light. In terms of competition-wise, if you look at us alongside something, so pregnancy, been in the market forever, in people's homes, have been for decades. If you look at us alongside the Clear Blue Digital, which is very well known, we can provide exactly the same quality and level of results in how far along someone is in their pregnancy, only we don't have to throw away a Casio watch every time you do a pregnancy test. There's no disposable technology, there's no plastics, there's no large amounts of packaging. You know, effectively, large amounts of this is just card. So yes, we have some environmental credentials, but it means our production costs are a lot lower as well, because all the technology is housed within the phone, something that people carry with them and integrate into their life every day.
Thank you very much.
Thank you.